Inflammatory bowel disease, or IBD, is a common chronic inflammatory disorder of the gastrointestinal tract, highly prevalent in developed nations. IBD includes primarily ulcerative colitis, UC, and Crohn's disease, CD, and collectively accounts for significant morbidity. Although these conditions similarly present with abdominal pain, diarrhea, and rectal urgency, both have differences in the pathology and clinical features. Crohn's disease characteristically causes transmural inflammation anywhere along the lining of the digestive tract, known as skipped lesions, while ulcerative colitis causes continuous superficial inflammation mainly in the colon. Historically, dietary therapy has been similar for both CD and UC, involving an increase in fluid intake, avoiding fatty foods, fiber, and dairy products if lactose intolerant. Presently, a dysbiosis of the intestinal microbiome is believed to be a major factor in the pathogenesis of IBD, and this change provides a possible pathway for dietary manipulations of the microbiome that may reduce inflammation in these IBD conditions. The human gastrointestinal tract harbors a complex and dynamic population of microorganisms that predominantly live in our gut, forming a symbiotic relationship to enhance the function of small and large bowel. It's known that antibiotics, stress, nutritional excesses, and deficiencies can alter the gut's flora and increase the potential for inflammation. Research is increasingly shown that diet can play a role in modifying the dysbiosis seen in patients with IBD. Recent publications have shown that enteral feeding, careful selection of foods such as prebiotic foods, probiotic foods, essential nutrients, and avoidance of certain foods that feed the adverse bacteria can assist with disease remission and lower the risk of inflammatory disease recurrence. The anti-inflammatory diet, or IBD aid, is a nutritional regimen for inflammatory bowel disease that restricts the intake of certain carbohydrates, includes the ingestion of pre- and probiotic foods, and modifies dietary fatty acids. Additionally, these foods may be further modified with blenderizing and cooking to help with digestion and absorption of nutrients. The IBD aid is designed to target nutrient adequacy and improve digestion and absorption of nutrients while ameliorating symptoms as an adjunct dietary therapy in the treatment of IBD. The management goals of IBD involves induction of remission, maintenance, and reduction in long-term steroid use. Apart from surgical options, the mainstream pharmacological anti-inflammatory agents used are corticosteroids, immunomodulators, and biologic agents. Diet is an emerging option to enhance healing and treatment for patients with IBD.